Well, as you said, got the unique perspective of pediatrician, internist, lipidologist, lifestyle medicine, and try to weave the best of both conventional medical management along with lifestyle medicine, which is having to do with nutrition, diet, exercise, sleep, stress management, avoidance of risky substances, using that biopsychosocial spiritual model. And the long title of my book and podcast would be Real Answers and Real Solutions for Real People with Real Pain and also real fatigue, which is often more of a challenge than the pain for people with fibromyalgia and related issues, and real brain fog. And looking at fibromyalgia is like looking at this big ball of yarn that is all these multiple colors representing all of the involved intricacies of these complicated fibromyalgia. That's why it's often many people don't want to, as in the medical community, deal with it because it's too complicated and they keep kicking it over to some other specialty, and no other specialty really has any comprehensive understanding of this. So you're left with somebody like myself who has the longitudinal perspective throughout the lifetime, from caring from newborns through old age and in between. And I actually take care of all ages who have these issues. And we'll talk about that today. And the title of this is Fibromyalgia, Chronic Pain, and Other Central Pain Syndromes and the Connections with ADHD and Autism. We'll start with a patient I saw this summer. And when it was a new patient to me, and before I walked in the room, I always will ask the nurse, like, any special things that they mentioned that they want to go over, just to get an idea that I make sure I cover that. And the nurse said, oh, no, she has no concerns. She's just here for a checkup. Walked into the room, and she was sitting there and she was wearing a mask. Well, not the mask that you're probably thinking of. She was wearing a smile and greeted me cordially and all of this, and sat down. And as she had reported to the nurse, she has no concerns and was just here for a checkup. And said hi and introduced myself, and she had no concerns like the nurse had said. But going through her medical record, electronic medical record, she had dysmenorrhea listed in her problem list. And a lot of times problem list is something that is not up to date, right? You might have had a strep throat 10 years ago and it's gone, or you had a hemorrhoid once 10 years ago and you're like, I don't have that anymore. It was a false diagnosis or whatever. So I was going through that and I said, is that still a problem? And she started to get some tears in her eyes, and she said, yeah. And I said, okay. From like 0, no pain, to 10 being excruciating, how painful are your periods? And she said, they're so bad, Dr. Lenz, I can't go to school for a couple days. And I said, oh, well, a lot of people who have painful periods also have pain in other areas in their body, like headaches, neck pain, stomach pain issues. And then she started to get more tears in her eyes. And she said, Dr. Lenz, I hurt everywhere. And I said, well, why didn't you tell the nurse? Why didn't you tell me that when you walked in? She said, Dr. Lenz, I've been hurting everywhere since I've been a kid. I've been to so many different doctors, pediatricians, and my OBGYN that I've been seeing for the last 2 years said, all that I can do for you is give you birth control. Don't expect any more. I think my mom and a lot of people think I'm just a hypochondriac. We're going to get to her at the end of my talk. Keep you posted. Fibromyalgia and these invisible illnesses are kind of like the tip of the iceberg. And under the surface, there's some things that we often get missed. And autism and ADHD often lie under the surface. They're frequently comorbid. They're rarely recognized by patients or the medical community. And they're extremely important to understand. And appropriate supports can make a big difference. And neurodivergence, not a quote medical term, but it's kind of a lay term that many people have heard of. And the main areas of that are ADHD and autism and other aspects, but I'm going to focus on those two aspects today. And when we talk about autism, I was trained as a pediatrician to consider it in kids in that, toddler preschool area, to pick up these delays in social communication, language, and to really get them access. But what we're understanding is that this actually continues into adulthood. And most people who have it, just like the tip of the iceberg, those are the ones who get identified or were identified if they're adults. Those are ones who had more severe struggles and impact. And now we're recognizing that a lot of this continues into adult life, never goes away, and always has been there when we look for it. Traditional testing, ADOS testing for autism in adults underestimates that because it's a different presentation, similar to how ADHD in adults doesn't look like a hyperactive 5-year-old. Autism common traits are finding it hard to understand what others are thinking or feeling, getting very anxious about social situations, finding it hard to make friends or preferring to be on your own, seeming blunt, rude, or not interested in others without meaning to, finding it hard to say how you feel. That's called alexithymia, and taking things very literally. For example, you may not understand sarcasm or phrases like break a leg, having the same routine every day and getting very anxious if it changes, not understanding social rules, such as not talking over people, avoiding or not preferring eye contact, getting too close to other people, or getting very upset if someone touches or gets too close to you, noticing small details, patterns, smells, or sounds that others do not, and may have a very keen interest in certain subjects or activities, and may like to call that enthusiasms, and liking to plan things carefully before doing them. In women, sometimes it can look different. They may hide things of autism to fit in by copying people and who don't have autism. They be quieter and hide their feelings and appear to cope better with social situations, but having a lot of internal symptoms and show fewer signs of repetitive behavior. That means it can be harder to tell if you're autistic, which is something that I am noticing a lot in my patients when I'm just asking the right questions. ADHD has 3 core symptoms. There's DSM criteria that you can look up, but if you boil it down to 3 core symptoms to remember, it's an interest-based nervous system, emotional hyperarousal, and rejection-sensitive dysphoria. Interest-based nervous system, despite its name, ADHD, doesn't actually cause a deficit of attention. It actually causes inconsistent attention that is only activated under certain circumstances. People with ADHD often say if they can get in the zone or hit a groove, these are all ways of describing a state of hyperfocus, intense concentration on a particular task during which the individual feels she can accomplish anything. In fact, she might become so intently focused that the adult with ADHD may lose all sense of how much time has passed. This state is, however, not activated by a teacher's assignment or a boss's request. It is only created by a momentary sense of interest, competition, novelty, or urgency created by a do-or-die deadline. Emotional hyperarousal are maybe things like, I always feel tense. I can never relax. I can't just sit there and watch a TV program with the rest of the family. I got to get up, walk around, and do things. I can't turn my brain and body off to go to sleep at night. And rejection-sensitive dysphoria is an intense vulnerability to the perception, not necessarily the reality, of being rejected, teased, or criticized by important people in your life. RSD causes extreme emotional pain that may also be triggered by a sense of failure or falling short, failing to meet either your own high standards or others' expectations. And this is extremely internalized. It can just hit like a ton of bricks, an emotional gut punch. And ADHD, in connection with key points about people who are neurodivergent, ADHD is more common in those who have fibromyalgia and other central pain processing syndromes. Treating ADHD improves ADHD symptoms and fibromyalgia and related symptoms. Autism spectrum is more common in those with chronic pain and fibromyalgia. Most neurotypical adults are unaware that they are on the autism spectrum or have ADHD. And identifying neurodivergence is important for families, for patients, their families, loved ones, and their doctors. Talking just a simple definition of pain, it's the perception of actual or perceived tissue damage. And pain differences. One study was done looking at the differences in pain experiences between those with ADHD compared to those without. And you heard of the cold water bucket challenge a few years ago? Well, this is called the cold water hand in the bucket study. And I think it's very interesting here. The researchers had the participants put their hand in a bucket of ice water, okay? And they asked these questions. How long did it take to develop pain between the two groups? How long were they able to withstand the cold before they had to remove their hands? So first, tell us all when it starts to hurt, and then keep it in there until it's intolerable. And what did they find? Those who had ADHD had less than half of time before they reported pain. And how long they could keep it in the bucket of water was nearly a third of what those who did not have ADHD. Then they did something interesting. You probably wonder, what do they do next? By the way, both groups removed their hands at the same level of pain, which was about 90 out of 100. So they both reported the exact same perception of pain, but it was at a different level. And then they looked at use of methylphenidate, generic for Ritalin, on time to withdraw their hand after the pain. And sorry, it got transferred over my keynote, but 210% longer when they had methylphenidate, nearly normalizing that to those of the controls in that light green there. And how long did it take for them to report pain also improved or had increased duration. Conclusions and results that suggest that people with ADHD are more sensitive to pain compared with controlled, and that methylphenidate may exert anti-nociceptive properties in these subjects. How many people with about 30 to 80% of people who have fibromyalgia and chronic pain syndromes have ADHD, and we'll talk about that. And part of that varies on the type of evaluation they did, and some may be underestimating it. A study looking at the prevalence of widespread pain in those with ADHD compared to controls. And what you can see here is that the widespread pain in those with ADHD was up to 80% in one study, and compared to only about 17% of those who did not have ADHD. Another study done in South Africa that many people have heard of, came in internal pain, showed that 45% of people screened positive for adult ADHD. We're using the World Health Organization ADHD Self-Report Scale version 1.1, which you can get online. That actually underestimates the risk. There's more detailed testing. We'll talk about that. Participants with both fibromyalgia and a positive adult ADHD test screened higher on their fibromyalgia impact score. So that a whole episode on that. If you don't know what a fibromyalgia impact score, go to How Bad Is My Fibro, one of my earlier podcast episodes. But that's from a 0 to 100. That's high. And then self-reported cognitive impairment was 11 times more likely to be rated higher in the combined group with ADHD and fibromyalgia compared to the fibromyalgia group without ADHD. 11 times higher cognitive impairment. And as I talked about, the screener is not as sensitive compared to the DIVA 2.0 and 5.0 and the Conners adult rating scales with the screener picks up about 60% of people with ADHD versus about 95 to 99% with a DIVA 5.0 and Conners adult rating scale. So it may be missing about 40%. So that may be underestimating, as we'll see in some other studies. So when they look at studies connecting likelihood of being autistic in those with chronic GI issues, and this was a pediatric clinic, this is meta-analysis was done, and the overall, when you average out the studies, about 4.5 times more likely to be autistic, or 2 to 10 times more likely to be autistic in those who had chronic GI symptoms. Kind of in kids, think of the IBS, chronic epigastric dyspepsia, chronic nausea, all of those kind of categories. And what they said in the consensus of that study is that experts, parents, and healthcare providers should be educated about possible GI symptoms and pathophysiology in autistic children, and children suspected of having possible GI disorders should be screened accordingly. And then I did a study, just a poll in one of the POTS groups, and it had a big response. And using the RADS with R, which you can get online, and do a cutoff score of 65 or higher is strongly suggestive of having autism. And about greater than 40% were greater than the cut point of 90. And so roughly about half were in that autistic range. And then a smaller group in the fibromyalgia Facebook poll showed that about 50% were in that autistic range. When we look at autism and chronic health, this was an observational study of central sensitivity syndromes in autistic adults. This study investigated the co-occurrence of these central sensitivity syndrome diagnoses and symptoms with autistic adults, and explore whether these central sensitivity symptoms were related to autistic traits, mental health, sensory sensitivity, or sex. And what they did was they had 973 autistic adults in the Netherlands in the autistic registry, and they completed questionnaires assessing autistic traits, sensory sensitivity, and evaluation for central sensitivity syndromes, physical and mental health issues. And this is because these are often connected, and they may express pain differently. What they found in this testing is that 21% reported, just on their survey, that they had a diagnosis of a central sensitivity syndrome. But based on the questionnaires they did, actually 60% were above the threshold for having a central sensitivity syndrome, which isn't completely all of the central sensitivity syndromes. In other words, 40% of them actually had one of these central sensitivity syndromes, but were never diagnosed. And then when we look at prevalence of ADHD symptoms in a clinical sample of children and adolescents with chronic pain, a study using the social responsiveness scale and ADHD scale were used. 14% met the criteria for autism, 20% had ADHD, and there was a combined of 26% having both, 26% and 8% scored cut off for both disorders. Interestingly, only 4.8% had a prior diagnosis of autism, and ADHD was 0.7%. So most of those who had with ADHD and autism had never been previously diagnosed. And then when we look at another study looking at chronic pain and health-related quality of life in women with autism and or ADHD, a longitudinal study. So they asked what happens to girls or adolescent girls with autism or ADHD in childhood and or adolescence later in life. So they followed a group of 100 people. This was done in Sweden, so they could track them with their socialized medicine system, see where they lived, not as much probably mobility there. And they looked at 16 to 19 years later, and 34 had autism as a main diagnosis. 31 of these had ADHD as a secondary diagnosis. 41 had ADHD as a main diagnosis. Chronic pain was in 77% of the women. That was 16 to 19 years later. This is more than 3 times that of women in the general population. And chronic widespread pain was 5 times greater in the autism ADHD group. And the most common locations were chronic low back pain, abdominal pain, and recurrent headache. And when they looked at protection, we look at protection of ADHD treatment of and chronic pain, those who had a diagnosis of ADHD in childhood, and then they looked into adulthood, those who were on ADHD medication stimulants, 16% had chronic pain. And those who had ADHD but weren't being treated, 42%. So big difference. The interesting thing was they found there was no difference in contact with a primary care doctor or a psychiatrist between the two groups. The big question is, why was there a gap in treatment when you have such a big difference? And we'll talk more about that. But it's a good question. Why? Why weren't they treated? There's another study that was just done a year ago out of Israel, looking at 52 adults diagnosed with autism and 52 healthy subjects, age matched and controls. And they looked at quantitative sensory differences to assess pain sensitivity difference. And what they found is in the dark blue here, at different temperatures of Celsius, they go up. Those who are on the autism spectrum reported on this numerical pain score from 0 to 100, how bad is the pain, reported on average a significantly higher level of pain for the same level for the same temperature. And when they looked at the differences between the controls, anxiety levels on average were significantly higher between the groups, and their pain catastrophizing score also was significantly higher. And then this PSQ stands for pain sensitivity, and that also was more sensitive. And then there's a sensory responsive questionnaire kind of going along with the autism, supporting, again, a difference that we know. So is that this latter, looking at another experiment here, sorry how it got transferred over to this presentation, but this study basically goes in the face of what many had thought, that people with autism don't feel pain. Actually, there's many of them are much more sensitive to pain. And then when we look at autism in girls and women, it's again usually missed. Now the ratio probably of women to men is about 5 to 8. A study done in Australia, when they looked at the difference between girls and boys with ADHD, the girls rated a higher number of somatic complaints, more body pain symptoms. We look at overlap of autism and ADHD. About 50 to 80% of people with autism have ADHD. Most with ADHD, however, are not autistic. Here's a study done out of Spain in 2011, finding a high frequency of childhood ADHD in women with fibromyalgia. And as you can see, 62% or 32% of them had prior diagnosis. What's interesting is boys are 2 to 4 times more likely to be diagnosed with ADHD than girls as of the study in 2011. And often that's now where girls are typically missed because they don't express as many externalizing symptoms, more internalized. This means that at least half were never diagnosed, and probably the 32%, probably if you were doing more careful assessment, probably could have at least been double that, up to 64%. If a tree falls in a forest and no one is there to hear it, does it make a noise? And well, the question is, if someone with a central pain syndrome walks into a doctor's office and the doctor isn't listening for autism, does it mean their patients don't have autism? Something to think about. ADHD prevalence, and a study from the University of Tokyo Pain Clinic, they looked at percentage of patients diagnosed as having ADHD among 153 consecutive patients experiencing chronic pain who had been diagnosed as having probable somatic symptom disorder, kind of a general pain disorder. I don't use that diagnosis, but they use that psychology sometimes referring to chronic pain, and refer to the Chronic Pain Clinic, University of Tokyo, 2016 to 17. And what they found is that 73% had ADHD, and this was based on the more detailed testing with the Connor's adult rating scales from the self-report and the observer rating. And then they also did the DSM, using DSM criteria, and at the time the DIVA 2.0 questionnaire for adults. What's interesting is that some of them, the self-report reported it, but the observer didn't, which means they were masking their symptoms of ADHD. And at times, the observer scores showed that they were in the ADHD range, but they themselves didn't report that. So often there's that missed awareness both by yourself, and I see that with patients. And so it's important to be aware of that. How many people, now they were looking back here, 73% had ADHD of that 153 or 51 people that came in. How many people do you think had previously been diagnosed with ADHD? None. Very sad. ADHD in that study, treatment was given to 60%. with methylphenidate or atomoxetine, which is Strattera. More people were offered, but there are some people actually, and I see this in my practice sometimes, where they just didn't believe they had ADHD. Like, I don't care, I'm fine, I don't have a problem, I'm okay. 73% of those who were treated had improvement in their ADHD symptoms, and their average numerical pain rating scale from 0 to 10, how bad is your pain, decreased from 3.5 points from 5.9 to 2.4. That's a mean drop of 61%. Quite impressive. Given that most chronic pain patients are examined by orthopedic pain clinicians, primary care, and rheumatologists who are unfamiliar with ADHD diagnosis, let alone treatment, it is likely that ADHD diagnosis is too often overlooked. The present findings, as they said in the study, illustrate the importance of evaluating patients with chronic pain for ADHD. And the core symptoms of fibromyalgia and chronic fatigue syndrome, which I think are synonymous, are fatigue, chronic pain, executive functioning deficits, also known as fibrofog, and sleep problems. So they did a study out of Australia. They had 20 patients divided into two groups. The patients in the treatment group received 5 milligrams of Adderall, then assessed twice a day, then assessed a week later. And if no benefit or side effects, they went to 10 milligrams twice a day, and then reassessed in a week, and they went to 15 milligrams twice a day if needed. What they found, and then they had the fatigue severity scale, which is from 1 low, which no fatigue, to 7 being very high levels of fatigue on that scale. Both groups had an average score of 6 to start with. And after treatment, the Adderall group went to 4.7, and the placebo group did not change. 9 out of 10 in the Adderall treatment group had improvement in the fatigue severity scale. There was no improvement in the placebo group. And then they used this short form health survey looking at for physical role and vitality. There were much larger changes associated with the dexamphetamine or Adderall treatment than the placebo. And the physical role of another functioning went from an average of 22 to 52.5, which a higher number is much better on this scale. And the vitality score went from 23 to 40. And what about the safeties? I mean, people sometimes, maybe there's a lot of stigma about stimulants. They only had 2 cases in their big clinic group out of 400 that had used dexamphetamine or methylphenidate, that used it inappropriately. And they concluded that dexamphetamine is a promising drug for management of chronic fatigue syndrome. A large trial with prolonged duration of treatment would be appropriate. And then there was a bigger study done, and they looked at those who had chronic fatigue syndrome and ADHD were treated. And it was another larger placebo-controlled study using Vyvanse, that's now generic in the United States, a long-acting version of Adderall. And what they looked at in particular was executive function struggles, which overlaps with fibrofog symptoms. 15 received Vyvanse and adjusting the dose, similar to the last study. 11 received placebo. And what they found here is that when you're looking at the general composite score of the behavior rating inventory of executive functioning, that after 3, 4, and then by the 5th visit, there was a marked improvement in those who were treated compared to placebo. And then, you can hit the pause button later and go back if you're watching this online. And this is some of the specific scales when they're looking at under that score of the composite score, going from 3.36 to 21 with the LDX stands for the generic form of Vyvanse. And then you have all of these other positive outcomes when it comes to cognitive function you can look at later. Fatigue severity scale also had a marked improvement, dropping markedly, as you can see. And then they looked at other things like the McGill pain scale, which a higher number, again, improving with the LDX. The fibromyalgia impact score improved. Again, could have been powered and had a more better p-value there. But of course, the ADHD rating scale improved. That's a measure of ADHD functioning. And then there's a HAM anxiety scale also showed improvement in functioning, which sometimes people think is paradoxical, but many people with ADHD have chronic anxiety, and that's kind of an adult manifestation of their hyperactivity symptoms. The study demonstrated that Vyvanse brought about significant improvement in functions of brain fog, fatigue, global pain, and global functioning. All right. Now I'm going to end with the case here that brings home both pediatrics and into the adult. This was a case study done out of Sweden. It's a 6-year-old girl who had chronic pain for 9 months. She had thought was just knee pain. 18 months to 3 years of age, she had begun to have continuous headaches, joint and muscle pain, and started to limp. She avoided bright and noisy environments. She had no relief with pain relievers. She was diagnosed initially with psoriasis, but was proven later not to be correct, and osteoarthritis. Significant history for migraines in both patients. She had been seen at various pain clinics. She had 2 normal head MRIs, neck MRIs, normal labs for rheumatology, Borrelia, Bartonella, thyroid, Epstein-Barr. All of those were negative. Her pain diagram you can see on the right here shows pain in multiple areas, head, arms, legs, and she was given piroxicam, but provided no pain relief and subsequently withdrawn. Disappointed with their care, they went to Arizona, where they thought she might have Lyme disease. Western blot was positive, but P39 was negative, and a laboratory found 1 Bartonella on a lab slide and treated her, diagnosed her with lymphoverticulosis, which is known as cat stress disease, with 2 months of treatment with azithromycin. The family subsequently went to Germany, where additional testing was done and carried out for Lyme disease, and this was positive both for IgG and P39 testing. Again, this was normal previously at the other testing, and got another 2 weeks of IV azithromycin and initiated another 3rd week. They went eventually back to Sweden and got oral azithromycin. According to her parents, the girl's sleep improved some after antibiotic treatment, but her pain didn't improve. She then went back to Sweden, where she was evaluated by a clinical psychologist. She continued to have severe headaches, joint and muscle pains, hypermobile joints, and hyposensitivity to pain from wounds. Fatigue and temper tantrums felt to be from pain by her parents. Light touch and pressure elicited pain worsened with activities. Social interaction, psychological stress, and audiovisual stimulation by intense light and sound generation generated more pain. Until age 4, she was not interested in peers or interactive play, uncertainty about rules and roles, especially if there was more than one person, anxiety and resistance to unexpected changes in activities and context, hyperactive during exam and needed to be playing with video games. She had special interests in horses and other animals, and problems getting ready for school and staying in school. A psychiatric assessment was done, and she was diagnosed with Asperger's, which now we would call autism spectrum disorder, as well as ADHD. She was given methylphenidate and acceptance and commitment therapy with supports at school being started. Sorry for this, got transferred over my slides, but the parents got education, structure, foreseeability for the girl, and a contingency plan for support behaviors, personal assistant at school. Continuous improvements occurred. Pain reported 1 night a week versus continuous pain, full school attendance. Mother couldn't work because she had to be with her daughter all of the time. Worked 75% of the time, and parents noticed pain would return significantly without methylphenidate therapy. And here again is this. What her level of pain was: a 10 before, after treatment, after 6, 3-month follow-up with the 5, and a year follow-up was 1. Anxiety score also went to 0. Depression scores went to 0, and pain-related worry went down. Again, you can hit pause if you want to look at that more carefully. And her pain map, this is on the left side, is what it was before, and then only having pain in the lower leg. Now, so my patient that I mentioned in the beginning, what happened to Sarah? Well, I did a careful history, and she had all the classic symptoms for restless leg, and she had growing pains forever, which were blown off and missed by her pediatrician, and just benign growing pains, and didn't realize that it was actually restless leg syndrome and periodic movement disorder. It was diagnosed, and we titrated her gabapentin, and that got better. We also then did the DIVA 2.0 with an ADHD questionnaire with clinical history that showed ADHD. We started her on Vyvanse and adjusted the dose to find the optimal range. We also did the CAT-Q, which is camouflaging autism traits questionnaire, which also supported the diagnosis of autism. She got education and was started. Also got on consistent exercise, eating more of a plant-predominant diet, and talked about good sleep hygiene. She reported within the first month, because we were able to adjust that within a month, she reported for the first time in her entire life, she did not have any pain with her periods. And she had excruciating pain before that. Her fibromyalgia FIQR dropped into the normal range from very high. And she had also improvement in her ADHD symptoms and functioning as expected. So if someone with fibromyalgia and undiagnosed ADHD or autism walks into a doctor's office and no one is there to hear them, do they make a noise? Yes, but we need to be listening, and patients and their families need to be self-advocates. And again, just thank you. I have a lot more that can be said, and that's why I do the podcast. That's why I wrote a book. Right now, as the time as this film has gone live, 126 episodes with 10 more already ready to be published. And if you enjoyed this talk, it does make a big difference to get this out to other people. If you go on Apple Podcasts, leave a rating and review and share that with others.